Hello everyone. So let's start with the new topic about vaginal discharges. I have mentioned this abnormal vaginal discharge, but first we will start about this. What is the normal vaginal discharge? What are the characteristic features of this normal vaginal discharge? And then in the next video, we will define or we will go with the type of the abnormal vaginal discharges and their causes. Okay. So let's start with this. What are the causes of the first vaginal discharges? Okay. So if you go with the causes, so first let's write the normal one and then we will write the abnormal one. Okay. Yes. So if you divide it into this, the non-infective type. This is non-infective type. In the non-infective type, which is the clinical features will be, it will be a non-purulent. There will be no pus formation. They should be non-offensive. And the third, it should be non-irritant. Okay? Non-irritant. So this is termed as your leucorrhea. So there are various causes of the leucorrhea. One is your physiological causes. The other two are the cervical and the vaginal causes. So the cervical and the vaginal causes we will do in our later video. First start with the normal one. Okay. So abnormal vaginal discharge is divided into a non-infective type and other is your infective type. So infective type, the characteristic will be they are the offensive in nature, they are purulent, there is a formation of the pus, there is an itching, okay, irritation, scratching. So all these things, they are the infective type. And there are the causes of there are some causes also for this infective type. We will discuss the later part. Other than this, if there is a neoplasm, okay, some growth in the vagina or the cervix or some due to some foreign bodies, okay. So this we will come to the later. Now let's start. What do you mean by the normal vaginal discharge, which was termed as your leucorrhea? So it is strictly defined as an excessive normal vaginal discharge. Excessive normal. So what do you mean by the excessive? There is no term. Okay. What is sometimes it is excessive, basically subjective to that of the individual to individual. So excessive normal vaginal discharges. So excessive is basically subjective to that of the person to person. But the leucorrhea should be non-offensive. There will be no smell. There will be no irritation, no itching. And this is a non-offensive, non-irritant and non-purulent. So this is a very much important characteristic feature of your physiological leucorrhea. Okay. So remember this. Sometimes they can ask you what is the normal physiological leucorrhea. It should be non-purulent. It should be non-offensive. It should be non-irritant. Okay. And also they are more during this physiological leucorrhea, they are clear or milky white, clear or the milky white. This clear and the milky white also they depend upon the phases of the menstrual cycle. Okay. Now they are odorless, non-offensive, okay, no itching, so non-irritant, and they are most commonly seen excessive during the puberty. If the patient or the person is in the ovulation stage, mostly due to the increase peak rise of the estrogen. Why? It is due to the peak rise of estrogen. So this can be one of the MCQ question, or they can ask you why leucorrhea is more during the phase due to the peak rise of the estrogen, which increases the secretory activity of the cervical gland. Okay. And also during pregnancy, also during the pregnancy and during the sexual excitement due to the abundant secretion from the Bartholin glands. So this is another important MCQ, and during the sexual excitement. Okay, why it is increased? Because when there is an abundant, due to this, there is an abundant secretion from the Bartholin glands. Okay, so this is another important MCQ. They can ask you when there is an excessive white discharge of a secretion from the Bartholin gland in which phase? That is during the sexual excitement. That there should be clean, there should be watery, there should be odorless, non-irritant, no non-purulent. Okay, non-irritant, non-purulent, non-offensive. Most commonly seen during the puberty phase, during the ovulation, during the pregnancy and the sexual excitement. Okay. Now to diagnosis whether this vaginal discharges is infective in nature or the non-infective in nature, or whether it is normal or it is pathological. So what we will do, we will take the discharge and put it into the microscope. Okay, so discharge for the microscopic examination, and if the pus cells is positive, then it is infective in nature, and if the pus cell is negative, then it is a non-infective in nature. So if it is infective, then we have to go for the further investigation to know the organisms, provided there will be no other cause such as the foreign body or due to some neoplasm. Okay, so these are the some of the short note. If they ask you to write a short note about the leucorrhea, you should write the leucorrhea. So its definition and its pathophysiology, the origin, that is your most commonly during the reproductive stage, that is during the puberty, it is more during the ovulation phase, during the pregnancy and during sexual excitement. Okay, the nature of the leucorrhea. So this can be a short note, and some of the question they can ask you, that is why it is increased during the your ovulation stage, mostly due to the increase of the estrogen, peak rise of estrogen, which causes increase in the secretory activity of the cervical gland, and it increases during the sexual excitement due to the abundant secretion from the Bartholin glands. So these two are very important. Okay, now let's move to some of the multiple choice question from the leucorrhea. So leucorrhea is best defined as a bloody vaginal discharge, foul smelling purulent discharge only, excessive white or yellowish vaginal discharge occurring only after the menstruation. Okay, so here the answer will be the excessive white or yellowish vaginal discharges. Now, physiological leucorrhea is seen commonly after menopause, during pregnancy and ovulation, in carcinoma of the cervix, in pelvic inflammatory diseases. It is seen during the pregnancy and the ovulation. Which investigation is most useful for diagnosis the cause of the leucorrhea? Is it CBC, urine routine, vaginal smear examination, or the X-ray pelvis? The answer will be vaginal smear examination. Okay. So normal vaginal discharge will be green and foul, associated with itching, odorless, non-irritating, blood stain. Yes, the answer is odorless and non-irritating. Okay. So this is small topic only about the leucorrhea. In the next video, we will go with the abnormal vaginal discharge, the cervical cause and the vaginal causes. Okay. And their clinical features.